Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune, and today I'm going to tell you everything you need to know about the calcium blood test, which is also sometimes called the serum calcium level. Now, if you're here, it's probably because of a bunch of reasons. Number one, your doctor recently added a routine blood panel and your calcium value either came back too high or too low, and so you're confused about what that means. Number two, and probably more common, is that you could be having a lot of symptoms that you can't explain. Stuff like fatigue, muscle cramps, tingling in your fingers, bone pain, or generally just feeling very off and tired. It could also be that you are being investigated for a thyroid or a parathyroid disease. It could also be that you've been diagnosed with osteoporosis, a disease or a condition in which your bones become weak and fragile, and this is typically seen in women, older women who are more than 60 or 65 after menopause. Even in older men, weakening of the bones is called osteoporosis, and it's one of the most common reasons why people need to get a calcium test done. Lastly, it could also be that you have a kidney condition in which your kidneys are not working properly and you're losing a lot of things that you shouldn't normally lose directly into your urine because your kidneys aren't able to hold them into your blood. So there could be also other reasons. It could be that you recently had a fracture and your doctor is wondering whether it's because your bones are very weak, and that might be because your calcium levels are too low. So there are many things that could cause you to be thinking about getting a calcium test. Maybe your vitamin D level was low and so your doctor says now you should also have a calcium test done. There are all kinds of reasons. What you need to understand is that the calcium that we are measuring in this test, so it is just a simple blood test. We are going to take a sample of your blood. We are going to measure the level of calcium in that blood sample and we are going to give you the report. Why is calcium so important? It's because calcium is essential for everything, from your heart rhythm, your muscle contraction, your nerve signaling, the way your blood clots, and of course, last but maybe even the most important, the strength of your bones. That is why the calcium blood test is a very important test. You can't afford to ignore it. Very few people realize how important this little mineral is. Everything that you think it doesn't do, it actually does. Calcium is an ion that is involved in all kinds of chemical reactions in your body, and so you have to know about this test. I want you to stick around with me to the end of this video. I'm going to tell you what the calcium blood test is, who should be doing this test, symptoms that you may have noticed which means that you should be getting this test done, what the normal levels are in men and in women, what abnormal levels mean, which diseases could be causing your calcium level to be abnormal, and which other tests you could also consider doing. So please do watch to the end of this video. Any questions you have, add them at the comments. Now let's go. This just doesn't work here. If you have symptoms like cramping in the muscles, bone pain, or feeling constantly tired, then you should definitely consider getting a calcium blood test done, and I'm going to tell you everything you need to know about the test. So what is calcium? Calcium is a mineral. It's the most common mineral in the body, and that is because it is the critical component, or the most critical component of your bones. It is very important for proper contraction of your muscles, the beating of your heart, as well as proper nervous function and conduction of nerve signals. The mineral is only obtained through food, and it is usually stored largely in the blood to some extent, but mainly in your bones. It's the most important thing to have strong bones. People who have easy fractures when they fall are usually deficient in calcium. And this is a blood test. The test that we are talking about is a blood test that measures the level of the total calcium in your blood. You realize that it does not tell us how much calcium is in your bones, but usually if your blood doesn't have enough calcium, then it would also mean that your bones are probably deficient in calcium as well. Now let's get into how the test is done and its normal ranges and symptoms that you may experience. So when do doctors advise a calcium blood test? There are three basic situations in which a calcium test would be advised. One would be in a situation where your doctor suspects a disease of your parathyroid glands. Now let me explain what that is. The parathyroid glands are a pair of organs which are present, two on each side of your thyroid. So the parathyroid are called para because they are present near your thyroid. This is somewhere in your neck region. And your parathyroid glands are the ones that control the complete regulation of calcium in your blood and your bones. If your doctor suspects a disease of the parathyroid glands, they will advise a calcium test to check whether the calcium levels can help them pinpoint whether this is a problem in the parathyroid glands, because if your parathyroid glands don't function properly, your calcium levels will be affected. The second situation is in people who have long-standing kidney diseases. This could be someone who has diabetes for a long time and where the diabetes has actually damaged the kidneys, people with high blood pressure where the blood pressure has damaged the kidneys. And this is because if your kidneys are damaged, they will not be able to metabolize and retain calcium properly inside your blood, and you may begin losing calcium in your urine. And kidney diseases usually lead to deranged calcium levels, and that is why it is always advised in patients who have kidney diseases, the calcium level helps us know somehow also the extent of the kidney disease. The third situation is probably the most common. If you are old, if you're above 60, your bones are becoming weak, or you're a young child who has been deficient on things like vitamin D, but you notice that whenever you fall, you tend to fracture one of your bones. Maybe you fractured a bone in your hip, in your knee, or your upper arm, or your clavicle. This is usually because your calcium levels are low and your bones are very weak and brittle. And if doctors suspect that you're having fractures very easily at the slightest fall, they will ask you to do a calcium test to make sure that it's not because of a calcium deficiency. So what are some of the symptoms that you may experience if your calcium levels are not as they should be? So muscle cramps, fatigue, feeling tired all the time, easy fractures, pain on the bones. If you just touch or press firmly on your shin or on your chest bone, you notice a lot of pain. All these are signs of low calcium levels, because of which your bones are painful, brittle and tender. Other than this, it is also possible that if you have a very deranged calcium level, you may experience things like palpitations or fluttering of the heart, because calcium is very intimately involved in the proper contraction and rhythm of the heart. So all these are, there are many different symptoms. You may experience things like frequent urination if you're losing calcium in the urine, kidney stones, kidney pain if you have so much calcium being passed in your urine that is now causing stones to be formed. So there are many different symptoms that you could experience. This is just a tiny list. How is the test done? So this is a simple blood test. You don't have to prepare in any special way. You don't need to fast before this test. You can take all your usual medications. The lab will draw around 1 to 3 ml of blood for this test. The tube which contains your blood will be transported to the lab, and the test will be processed in a biochemistry analyzer. The results are usually available on the same day that you provide the sample, because the test is not complex. It is a fully automated process, and you will be provided a value with units as milligrams per deciliter of blood. What are the normal ranges of the calcium blood test? For this test, I've included the ranges for men and women on this page. As a rule of thumb, we usually look for a value somewhere between 8.5 to 10 milligrams per deciliter. That's a generalized broad range of what the calcium level should be. You can see the specific ranges on the slide. So what are the causes of an abnormal calcium level? So first I'm going to tell you the causes of a higher than normal calcium level, because even this is seen sometimes. If your parathyroid glands are overactive, they may cause your kidneys to retain a lot more calcium in your blood than is required, and your calcium level will rise. Number 2 is if you have a cancer that has spread to your bones. This sometimes happens in cancers like multiple myelomas, or in men who have prostate cancer, it spreads through into the bones of the back. The cancer causes the bones to be destroyed, and when the bones are destroyed, the calcium in the bones begins to spread, begins to leak into the blood, and your blood calcium level rises. So if you have a cancer that is spreading into different bones of your body, this also includes primary bone cancers themselves. It can cause high calcium levels in your blood test. Other than this, too much vitamin D, there are people who are little paranoid about their vitamin D levels, and so they keep consuming vitamin D supplements. Vitamin D is something else that forces your kidneys to retain a lot more calcium than your body needs. and this can cause your calcium levels to shoot up a lot, and this can be dangerous. Now, what are the causes of a low calcium level? These are almost the opposite of the causes of the high calcium level. So if your parathyroid glands are destroyed, or they're not working properly, or you don't have enough vitamin D in your blood, your kidneys are not going to hold back as much calcium as is required, and your calcium levels will be low. Other than this, a kidney disease that itself affects calcium balance. For example, your kidney is diseased and it's not able to function properly, it's not able to carry out its primary function of actually making sure that calcium is not lost from your body into your urine. Well, that can also cause low calcium levels. Last but not the least, if you are malnourished, if your dietary intake of calcium is insufficient, you will definitely land up with a lower than normal calcium level, but that can take a very long time because your body will first try to absorb as much calcium as possible by actually weakening your bones. So these are some of the causes of high and low calcium levels.